Hello, my name is Dr. Carlo Renato. I'm a chiropractor from Sydney, Australia, and it's with great pleasure that and anticipation that I'm heading to Rome September 22nd, 23rd to present this great seminar, Managing the Dizziness Patient. It's something that I've been sharing for a number of years, and it's something that I always get a kick and a buzz presenting this. And it's the first time that I'm doing this in Rome. I've got many colleagues that will be attending, and I look forward to meeting many new colleagues as well. In this particular video, I'm going to be talking about the relationship the cervical spine has with the vestibular system. As chiropractors, we know that when someone has dizziness symptoms, that we know that for a good number of these people, that by looking at their neck or their TMJ, we can improve their symptoms and function. But how do you explain that? I think we need to move in a contemporary model to explain what is it that we do and see as chiropractors in helping manage patients with cervicogenic problems that relate to vertigo or dizziness symptoms. And I want to spend a bit of time talking about that because I think part of the goal that I want to have is to move our profession forward. I want to make sure that as chiropractors we can keep hold of our tradition, but also move forward with clinical neuroscience. And really, this topic on the cervicogenic spine does that beautifully. In fact, I talk on a whole weekend just on this topic itself. So I'm going to condense it for you guys, and we're going to talk about what happens to the cervical spine when there's a joint problem, when there's a subluxation, when there's a whiplash injury, when there's a concussion, when there's arthritis, when there's a chronic pain disorder in the cervical spine. And you can use whatever terms you prefer, but we'll keep it contemporary, and we'll look at when this happens, what happens to the neurology, what happens to your vestibular system, what happens to your balance system, what happens to your oculomotor system. So we'll bring you up to speed with a connection, and with that understanding, you'll now start to appreciate what's happening, how can you better assess what's happening, and what other tools that you can use to better manage these patients as well. Because ultimately we want our profession to improve and move forward. We want our patients to improve and get better results so they can speak more highly of us as chiropractors. And we want us as professionals to move up that level as well. So hopefully this topic does that. There's a lot of topics we're going to cover in this area. We're going to look at proprioceptive aspects. We're going to look at neuromotor aspects of the cervical spine. We're going to look at oculomotor components as well as balance. So we know that we can assess the spine with palpation, with orthopedic tests, with motion palpation, with whatever tests that we currently use. All right, but I'm going to add to that. I'm going to look at what's the literature showing us. How applicable is it for a chiropractic office? And if we have a busy practice, what can we do that can take minimal time but give us really good results? This is what's going to happen. We're going to cover that. And one of the things that does it best is when we look at proprioceptive. We're going to look at head-mounted lasers. We're going to look at wall charts and things that I'm going to bring to the seminar as well that we can both use and you guys can purchase as well. So it's a great aspect, something that I get the best reviews and comments about wherever I teach this, and we're going to bring it to Rome as well. So be sure to join me in Rome September 22, 23. Early bird closes August 24. So be sure to register as soon as you can and take advantage of our early bird prices. We're likely to sell out before that. We've got limited space available in the venue that we have, so be sure to secure these spots now. If you have any questions or if you want to register for the event, go to www.brainhubacademia.com.au and you can register and you can secure your spot. If you have any questions, you can certainly ask me. Until that time, until September, I look forward to seeing you guys then. Bye for now.